the time. Let's head right down to Washington right now at this very critical, very important time for the nation. John Faso, new congressman, although not new to politics, that's for sure, from Kinderhook, New York, joining us right now. Good morning, Congressman. Thanks so much for being with us.
Good morning, Fred.
You're part of this very important Republican majority now. It must be nice for you to be in the majority. Put out yesterday the alternative to Obamacare. If you would talk to us about it, where do you stand on the House leadership's recommended program to replace Obamacare?
Well, the first thing, Fred, keep in mind, the ACA has got serious problems in terms of its disruption of the insurance markets. And we could just sit back and do nothing and allow it to...
It's job-killing quality, too. Let's just note that as well for the economy.
Oh, yeah. And the number of employers that I have met in the last year and a half who've told me about reduced employment, increased part-time employment at their firm because of aspects of the ACA. So it has had a definite negative on the economy. There's no doubt it has provided health care for many people, but it has also increased the cost for many more. So it's a situation where I've said all along we should keep what works and fix what doesn't work. And I think the legislation that was put out yesterday, and I'm still going through this legislation. And
you should have a chance to read it before it's passed.
Yes, and I have some specific issues that I want to have more information about, and it will undoubtedly go through markup this week in both the Ways and Means and Energy and Commerce committees, and then it will go next week to the Budget Committee on which I sit. So I'm going to have be going through this with a fine-tooth comb.
What do you think of it so far?
I think,
for instance, is this something you could vote for right now?
I need more answers to the questions, but I like the general direction in which they're trying to move to a more patient-centered healthcare system. They're employing some important insurance market reforms, although a lot of the market reforms that have to happen will take regulation from HHS in order to occur, and other changes have to happen in legislation where we're going to have to get at least some Democratic support in the U.S. Senate to pass. So I think that they're trying to move to a more patient-centered system, and here are the specific questions that I have about the proposal. One, do the advanced refundable tax credits actually provide enough ability for someone who is of modest means in the individual market where the employer is not providing the insurance? Is the credit, the advanced refundable tax credit that's offered, is that going to be sufficient for them to buy a plan that will work for them? That's the first question. The second question has to do with the so-called high-risk pools or reinsurance pools. This is where people that have very high health costs or have had pre-existing conditions where they may have high health costs, that's where I want to make sure that the amount of money that has been set aside for those high-risk pools will be sufficient to meet the need. And the third thing I want to see is a actual dollar breakdown of the block grant, which would be flowing to the state. One thing that I know is good in this proposal is that they use 2016 as a base year upon which to base the block grant funding. And, Fred, I have long felt that New York needs much more flexibility and the states need more flexibility without having to go hat in hand to Washington every time they want to make a minor change to the Medicaid program. So New York, for instance, right now has almost, as I understand it, almost 100 plan amendments pending at HHS where they have to go hat in hand for approval. There's no reason why many of these details have to receive Washington's approval. So those are the kind of things that I'm asking questions about now. I'm working on some other things that I'd like to see included in the legislation, but the trend, what they're trying to do is to create a more patient-centered system, one that reforms the mistakes that were made in the insurance regulatory side on Obamacare, and I think those are very, very good and productive initiatives.
Is it fair to say that you accept the fundamental premise, though, of Obamacare of having the federal government directly involved in making sure that health care is provided for virtually all of the American people? Or are you on the side of the, I guess, conservative Republicans who say that it should be a free market situation and that it is not the government's role to have kind of a socialized medical system?
Well, I think that academic dispute is an interesting one, but it's not one that I'm looking at in terms of the practicalities of how we do this. And I know some of the very conservative members are saying, well, they don't like the advance refundable tax credits because they think that's Obamacare light. And yet they ignore the fact that if you are one of the 170 million Americans that receive employer-provided health care, that employer-provided health benefit is not taxable to you because it's specifically exempted from taxation under the IRS code. That is a subsidy as well. Yeah. And so what the effort that this legislation is trying to address is to remedy the inequity where the person who receives employer-provided health care receives a tax-exempt subsidy when their employer provides the health care. But the person who's trying to buy the health care, if they're self-employed or the employer doesn't provide health care, those people are really left without a real subsidy whatsoever. So the way in which it's fashioned is not as a tax deduction, because if you're low income, a deduction doesn't benefit you. It's fashioned as an advance refundable tax credit. In essence, they'd give the person a piece of paper that says Joe Smith is entitled to $3,000 as a credit to help buy insurance for him or and his family. It would be bigger. So that advance refundable tax credit allows you to go to an insurer like MVP or CDPHP or whomever and say, here's what I have, and then the insurer claims the dollars from the government directly. So it's a method to try to equalize the disparity that now exists, where if you're self-employed or your employer doesn't provide insurance, you receive no subsidy from the government, unlike people who receive employer-provided health care.
I think that's a very well described on your part distinction between the two, and it provides action trying to go in a direction that the leadership in the House and yourself, I gather, would like to go in. What do you make of the impact on New York? I mention that because Bill Hammond has an interesting analysis. You may have seen it on the Empire Center's webpage, in which he says that it's not bad, quote unquote, as some of other proposals could be in terms of its impact on New York, but it still could cost New York $4 billion several years down the road.
Well, here's what I have to say. One, the expansion of Medicaid, the states were promised 90% of the new people that came in, and primarily these were employable single adults. And obviously some of them perhaps aren't employable. I'd like to see work requirements, number one, but be that as it may, that's not in this bill. But I do think that it was unlikely, given the precarious nature of the federal government's finances, that 90% reimbursement from the federal government would have been continued. And if you ask yourself the question, why should the federal government reimburse 90% for a single adult or an employable single adult through Medicaid, whereas the reimbursement we receive for someone who's disabled or a senior in nursing home is only 50%? So I think that
what's the answer to that? Why was it structured that way?
Well, it was structured that way because the ACA wanted to give an incentive to the states to bring a whole new crop of people into Medicaid, and New York had previously been covering some of these folks, and that was the incentive. Remember, there were 20. When you hear the number 20 million people received health insurance under the ACA, 8 million of those people purchased subsidized insurance on the exchanges, or some of it was subsidized, not all of it, and 12 million people received health care through the Medicaid expansion. So that's what that's the dynamic, those 20 million. And the question is, how do we make sure that we, as we move to a block grant, if this is what gets enacted, how do we make sure that we protect the folks that got the expansion, but also try to move them into commercial insurance and out of Medicaid, and hopefully into a job where employer-provided health care might be available, and provide the tax credits, which are kind of the morally akin, if you will, to the premium support that the ACA provided to people who were income eligible in the exchange. So there are a lot of moving parts to this, and
sure.
there's no perfect system, there's no perfect answer, but I think the overall, and this gets to your earlier question, a system which is more market-oriented, where you have a fair insurance regulatory system that is actuarially sound, and one where we encourage people to move into private health insurance rather than relying upon the Medicaid system, is one that is a better public policy for our country and our state.
John, just quickly, is there a sense amongst you and your colleagues that, in fact, Republicans have to avoid an all-out civil war over this and have to reach a resolution or face a potential disaster next year in the elections?
Fred, you are much better at prognostication on politics than I am.
Well, you're there. You're in the middle of it. Do you think there's going to be a resolution peacefully, or is it going to just fall apart?
Well, how peaceful it is, that remains to be seen, but I think ultimately it is my expectation that we're going to be able to come together and adopt something. A lot of these, I ran on fixing what works keeping what works in the ACA and fixing what doesn't. Some of these folks ran on just straight repeal. Others ran on repeal and replace. And I think that there's a happy medium that I believe we can come to, but it has to be a patient-centered, market-oriented system, because otherwise the current path of the ACA is simply not sustainable. And I think that's what the last message I'd really like to leave with your listeners is that the markets are falling apart in many states, and the insurers are pulling out of the exchanges, and there's no way that we should just sit here and let that deteriorate further. We need to try to fix it and restore stability in these insurance markets. Some of these markets are in much more disarray in other states than they are in New York State. In fact, New York has had probably one of the least disruptive insurance market situations among the states. So we don't see it as much, but I hear a lot of it from my colleagues, and that's the impetus behind a lot of this initiative, because there are states where the premiums have gone up 50, 60, 70% in the last 2 years, and that's simply not sustainable.
John, just quickly, we only have about a minute remaining. We're talking to Congressman John Faso, of course. What's the mood like around in Washington now in the age of the WikiLeaks leaks yesterday? President Trump suggesting that former President Obama was bugging him. The Democrats are suggesting the Russians were working with Trump. Do you feel all this kind of swirl being down there in Washington? You know,
a lot of it is the swirl, and I frankly, from my vantage point, I think the whole country would all be better off if there were less pot shots politically and if there were fewer tweets, shall we say. But I do think we need to focus on the issues. The big issue from my vantage point is that we've got to get the economy moving. We've got to get jobs and more prosperity and more opportunity for people. And in order to do that, we've got to fix some of the regulatory mess. We've got to fix the ACA, and we've got to reform the tax code. Those, to me, are the things that we've got to keep our eye on and not get diverted into kind of petty partisan squabbles.
Sure.
Those will always exist, but these aren't the issues that the American people sent us here to Washington to try to deal with.
Fair enough. Congressman John Faso, thank you so much for joining us this morning.
Thank you, Fred.
Take care. Keep up the work for the people of the Capital District and of New York and the nation, which we hope all elected officials will be doing. This is Fred Dicker. The show is live from the state capitol. It's time for the news.